Hello, I'm Shannon Navoa, and I'll be doing my discussion on humanistic therapy and existential therapy. Humanistic therapy, according to Rogers, is not just a way to solve problems, but a way to assist clients in their growth process. This way, the clients can better cope with problems as they identify with them. The basic components of humanistic therapy is having an openness to experience, to be able to trust in themselves, have an internal source of evaluation, and a willingness to continue to grow, especially after therapy has ended. The therapist doesn't choose any specific goals for the client, but wants the client to be able to recognize when they have lost themselves and how to be able to gain themselves back. Now, according to existential therapy, the basic dimensions of human condition will include the capacity for self-awareness, freedom and responsibility, creating one's identity, and establishing meaningful relationships with others. This search for meaning, purpose, value, and goals in someone's life is also important in existential therapy. You want to be able to deal with anxiety, having to deal with everyday life, and to be able to have an awareness and acceptance of death. Humanistic therapy is a valid therapy because I feel like it's a good way to get people out, to let people be responsible for themselves. It allows them to have an optimal self-regard, to try and separate their behavior from themselves. I think this therapy is also good because it focuses on the person themselves and deals with their problems separately. It helps the person to learn about themselves, to get them to open up and be flexible with world experiences. Secondly, I feel like this gives a person a way to develop and learn more about their personality. This may decrease any type of defense mechanisms that they've created, and this can help increase self-directed expansion of self-awareness. Getting a person to realize that they sometimes have to let go of any inhibitions to be able to grow and to continue to allow their personality to grow. I also think that existential therapy is a valid therapy because it gets clients to recognize if they're not living a fully authentic life. This allows them to be able to make choices that will lead them to becoming more flexible and a more capable person. Another aspect that I find interesting about existential therapy is the terms with coming to terms with death and finding meaning in someone's life. Once a person can fully recognize that death is inevitable, they can start to live life fully and live each day out. I think that once a client is able to create a world and having an understanding for themselves, they can live for what they want. They can invent a purpose that is strong enough to hold their life. And they can also realize that life is painful and difficult, but find coping mechanisms to deal with these events. Once a person confronts all these issues, like death or any stressors they have, they will be able to confront this and be a fuller, richer person and live a more compassionate life. Humanistic therapy, I feel, is good in a crisis and problem situations. It's good in dealing with depression and substance abuse. In regards to crisis intervention, such as an unwanted pregnancy or an illness, this therapy will allow the client to fully be able to express themselves. The use of sensitive listening, hearing, and understanding are very important concepts. The client needs to understand that they are being heard and that the therapist understands what they're going through. We can help ground people in a crisis and help them calm down. In the midst of turmoil, this will be able to help them think much better to make clear decisions. This humanistic therapy offers a genuine support, caring, and non-judgmental area. I feel like this warmth will go a long way in building a relationship with the client and therapist. This will also help motivate people to do the work and to be able to confront whatever crisis they face. Even though existential therapy doesn't set a set technique or guidelines in treating clients, I feel like this can be applied to anxiety, impulse disorders, and individual relationship, family problems, as well as marital therapies. The interventions that existential therapists can use are based on more of a philosophical view about the nature of human existence. They prefer description and understanding and exploring the client's subjective reality as opposed to a diagnosis or treating a person. The existential approach will focus on client's specific areas, and they can also get the client to assume personal responsibility, making a commitment to something and deciding to follow through, expanding their awareness for any current situation. I feel like these two therapies can work really well together because the two viewpoints do have a lot in common, but they also have philosophical differences. They can be combined because they both respect a client's subjective experience. They are unique and individually tailored to each person and client's needs. These are all goal-oriented, and they all aim to make positive, constructive changes in a person's life, to get a person to realize the choices that they make can be conscious decisions. They both emphasize on a person's freedom, choice, their values, personal responsibility, and the purpose and meaning in their lives. I feel like the combination of these two can be used to treat something like an anger issue. For instance, if someone comes in and they're angry, using humanistic and existential therapies to be able to allow them to work on their anger. You can combine these, and the goals would be to allow the client room to talk about what made them angry, how they are angry. This will also give them a chance to let the therapist respect their feelings, to understand their experience, emphasize their freedom and their right to choose, how they can choose to let go of the anger, move forward, and live a full life. They can also find a way to take personal responsibility for whatever role they may have taken for their anger. I would like to show a video that shows the therapist working with themselves using these types of therapies. I have a video of Carl Rogers using a humanistic approach or a person-centered approach with an actress. Her name is Gloria, and I think it will be interesting.
We have half an hour together, and I really don't know what we'll be able to make of it, but I hope we can make something of it. I'd be glad to know whatever concerns you.
Well, right now I'm nervous, but I feel more comfortable the way you're talking in a low voice, and I don't feel like you'll be so harsh on me. But,
I hear the tremor in your voice, so there it is.
well, the main thing I want to talk to you about is I'm just newly divorced, and I had gone in therapy before, and I felt comfortable when I left, and all of a sudden now the biggest change is adjusting to my single life. And one of the things that bother me the most is especially men and having them into the house and how it affects the children. And the biggest thing the thing that keeps coming to my mind I want to tell you about is I have a daughter, 9, who at one time I felt I had a lot of emotional problems. And I wish I could stop shaking. And I'm real conscious of things affecting her. I don't want her to get upset. I don't want to shock her. I want so bad for her to accept me. And we're real open with each other, especially about sex. And the other day, she saw a girl that was single but pregnant, and she asked me all about it. Can girls get pregnant if they're single? And the conversation was fine, and I wasn't at ease at all with her until she asked me if I'd ever made love to a man since I left her daddy. And I lied to her. And ever since that, it keeps coming up to my mind because I feel so guilty lying to her because I never lie and I want her to trust me. And I almost want an answer from you. I want you to tell me if it will affect her wrong if I told her the truth or would.
And it's this concern about her and the fact that you really aren't, that this open relationship that has existed between you now, you feel is kind of...
Yes, I feel like I have to be on guard about that because I remember...
I like this video because I feel like it shows Carl Rogers talking to Gloria in a sense of being able to let her have the floor. He lets her describe what's bothering her. He lets her know by his nodding or him saying that he's listening. And this is a good example of person or humanistic therapy. I also have a video that shows more of an existential analysis of a person.
From whom we did not feel that acceptance or receive that acceptance. And, you know, as you spoke, I started to go very deep within myself, and I had that that sort of forlorn image of a little boy, all alone, feeling alien, feeling not a part of, and absolutely believing that he was not acceptable. And you know, I mean, I've got the well-worn story of being adopted, and then being adopted into a home where there was no love demonstrated, no love shown, and you know, later discovered there really was no love.